Hi guys, it's me, Dr. Yumna Asad, and today we are going to discuss a very important topic in pediatrics cough cluster, that is bronchiolitis. If you're following my previous videos, you must be aware that I have discussed with you that we will be covering the pediatric section in a cluster-wise manner, and we are starting this cough cluster with the very important topic of bronchiolitis. So let's begin. Here is a case presentation I have made for you. It will not be exactly the same, but it will be very similar to this one in case of EMC clinical. So usually it comes like this, like if you are a HMO at a tertiary care hospital, a 4 months old or 6 months old baby is brought to you in ED by parents with complaint of cough for a few days. So here the important points you should remark down are: you are a HMO and the baby is brought into ED with a complaint of cough for a few days, and the age of the baby is 4 months. Last night, the baby had some difficulty in breathing, and parents noticed some noisy breathing, which made them worried. Baby is immunized to date, and there is no family history of asthma. So important things are, there are some things given in the history. So it means that you don't need to take a complete history. So as you can see, there are 4 tasks. So you need to cover these 4 tasks in the given 8 minutes time. So definitely you should not give more than 1 or 1.5 minutes to each task. So take further relevant history, physical examination findings from examiner, differential diagnosis and your probable diagnosis, and briefly outline the management. So you need to be very quick. So because there's cough, if there's any shortness of breath, you need to cover all of them. So be very quick in taking the history. Here's another case presentation in which you need to take a detailed history. There's nothing given in particular. It's just that you are a HMO in a tertiary care hospital and baby is brought in by mother with a complaint of cough and fever for 3 days. So it's very non-specific. There's just cough and fever, and all the rest of things you need to explore. So your task here are to take a history. Here you need to take a very complete history, I can say, and the physical examination findings from examiner, and explain the diagnosis and differential diagnosis. So there's no management. So here in this, you can say that the predominant assessment area will be either history or a diagnostic formulation. So history will be very, very important here. You need to ask everything in detail. Okay, so starting from the history. First of all, in both these scenarios, the child is brought to you with a complaint of cough or fever. So start with the history of cough. If you're following my previous videos, in the last video I have already told you what are the important questions to ask in the history of cough. Again, I'll be repeating those. So if there's a patient who has come to you with cough or shortness of breath or something, so it's better to ask with hemodynamic stability. If you're going for an online examination in AMC clinical, so the examiner's video will be turned off. So there won't be anyone who can tell you about the hemodynamic stability. In that case, it's usually given that patient is either hemodynamically stable or unstable. So it's usually given. But if you are going for face-to-face clinical examination, you can ask the examiner, just go inside the room, meet and greet the patient, the parent, and ask them, I'm here to help you out. Can you please spare me a moment? I need to check the vitals of my patient. And then ask the examiner, may I know, is my patient hemodynamically stable? If the examiner says, most of the time they say, yes, please proceed to the next task. Then you need to start with the history. So what are the important points in history of cough? First of all, starting with the duration. Since when is the child having cough? How severe it is on a scale of 1 to 10, with 10 is the most severe cough. Is it dry or is it productive of some sputum? What is the character of cough? Is it barking, honking type, and ask different other types by naming them, or is it cough, 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 and whoop, suggestive of pertussis? Then also ask about the diurnal rhythm. That is there any particular part of the time of the day when the cough is more, or is it same throughout? Does the cough bother their sleep? Wake the child up from sleep? Also, if it's continuous or if it's episodic. Now check the pattern of cough. It's very important, as I told you earlier, in case of psychogenic cough. That is, if the cough is present every every day, including the weekends, or only during the weekdays. Other things are the associated features. Very important here. In case the associated features could be fever, rash, sneezing, runny nose, any shortness of breath, noisy breathing, vomiting, and so on. You can ask what is relevant to the case. Then ask about any family history of asthma, eczema, or hay fever, and if there are any pets and carpets at home, or any evidence of passive smoking. Also, in case of cough, contact history is very, very important. You need to ask if the child is attending any childcare, daycare, or kindergarten or school, or if there's any sick contact at home. If the next important thing is to ask about if the child is active or lethargic or irritable, and if the child is feeding well or not. Have you ever, if the child is small, you can ask about the number of wet nappies, or if the child is in a larger age group, so you can ask about has the number when was the last time when the child passed urine? Have you noticed a reduction in the frequency of passing the urine? Now, any similar episodes in the past, it's very important. Any similar illnesses in the past. And next one is any chance of foreign body inhalation. And the most important things in case of pediatrics is BINDs, that is birth, immunization, nutrition, developmental problems, and social. So you don't need to ask all of them at once. What is relevant, you need to ask that. And all of the cases, immunization is must. You need to ask if the child is coming to you with cough. Immunization is a very important question to ask about. So I've told you all the questions regarding the cough. So history of cough. In this particular scenario, definitely you have cough, there's difficulty breathing, so you need to cover both of them, and there are other tasks as well. So you can't take so much detailed history. So just try to focus on what important things you need to ask about. For example, in this scenario, because the child has come to you in emergency, so you should be very quick in asking the history because you need to do the management as well. So what you are going to ask is, since when is the child coughing? Is the child having any fever? Is a cough dry or productive? And then ask about how is it associated with any. Now, directly move on to there's no need to ask about the severity or all this, because you need to jump onto the management. So just try to move on. So if the child is having any fever, any associated shortness of breath, is the child making any? And now, if you, once you ask about the shortness of breath, they will definitely tell you that yes, we have noticed some shortness of breath as well. Or in case of a young child, they will tell you there's some difficulty in breathing. You can also ask, is the child making an extra effort while breathing? So the parents will give you some positive history regarding this. So now let's jump on to the history of difficulty in breathing. Again, if you have asked about the hemodynamic stability at first place, there's no need to ask about it. The next thing is again the onset. So how did it start, this difficulty in breathing? Was it sudden or gradual in onset? Have you noticed there's a child is making an extra effort for breathing? Have you noticed any skin color change of the child? So sometimes there will be cyanosis, and parents will come and tell you that there's some bluish tinge of the skin. So it will indicate cyanosis. So ask the parents, have you ever noticed any change in the skin color? Have you noticed that the child is having any pauses while breathing? Have you noticed any musical or noisy breathing? Any similar episodes in the past again? And now these are the same questions you have already covered in the history of COVID, that is associated symptoms and the feeding questions, the activity level of the child, and the family history, and binds including the most important of which is immunization. Here are the physical examination findings that you should ask from the examiner, or that should be asked, including the vitals. That's the first important thing. The next thing important is the general appearance, including if there's any pallor, rash, any dehydration, or any cyanosis. In respiratory system, you need to ask all, including inspection, palpation, percussion, and auscultation. So you need to ask in detail what are the findings. And then the next thing is CVS. Just briefly ask if there's any positive finding in the CVS. And because there's cough, there's fever, so you need to cover ENT. There's no need to ask in detail regarding the rest of the systems because you don't have much time. So these are the most important physical examination findings that you should cover in this scenario. With that. So now moving on to the tab, now you have to talk to once you have taken the history, you have asked the physical examination findings, then it's the next important task is to tell your diagnosis and differential diagnosis. So you need to explain the appearance in layman terms. that you are suspecting the child is having. So it's very clear from the history that the child is having a condition called bronchiolitis. What is that? It is basically an inflammation of smaller airways called bronchioles. You can just tell the parents that it's caused by a viral infection. It resembles like a common cold, but it differs from that because it causes inflammation and basically swelling of the smaller airways called bronchioles. There's swelling of the smaller airways, and also there's increased mucus production, so making the air entry and air exchange difficult. That's why the child produces some sounds while breathing, especially while breathing out. So you can have, because the parents will tell you that the child is producing some musical sounds while, or some whistling sound while breathing out. That are the wheezes. So again, so the diagnosis in case of bronchiolitis is mainly clinical, based on the history and physical examination findings. You diagnose bronchiolitis. In very rare cases, when you are with some diagnostic confusion, you can go for chest X-ray, but it's not recommended, and it's only used when there's diagnostic uncertainty. So in AMC, usually there will be very clear-cut scenario of bronchiolitis, and you can tell the parents that don't worry, it's not a very uncommon condition. It's caused by viral infection, mostly the respiratory syncytial viruses. Most commonly affects children of age less than 12 months of age, and it's an airborne infection that it's contagious. It can be transmitted through airborne droplets. So the treatment is supportive. All you need to give is fluids and oxygen as needed. Not always, but as needed, as I told you. So based on this, if you refer to the RCH guidelines, based on the symptoms, the activity level, and the oxygen saturation levels, they have divided into mild, moderate, and severe. The most important thing here to consider is basically the oxygen saturation level. If it's above 92%, it means that the child is having a mild form of the disease. If it's 90 to 92%, it will be moderate, and less than 90% will be severe. Anything that is less than 90% or severe, you need to admit the child. That is, hospitalization is required as necessary. So keep that in mind. Less than 90%, admit the child. 90 to 92%, it's better to keep the child in observation for some time so that the child's condition does not deteriorate. In that case, it's your decision, or it's better you can say that I would like to ask my senior or the consultant to have a look at the child, and if they decide, they might keep the child in observation for a few hours till this child's oxygen saturation level goes above 92%. Sorry. And if okay, so here I have talked about the oxygen saturation levels. So usually the AMC, they give you some oxygen saturation levels, and based on that you need to tell the management. If they say, so for example, that the oxygen saturation level is 91% and the child is having some cyanosis, then it's better to keep the child in hospital for observation for some time till the saturation levels go up. If the child is very well and child is doing well, and the oxygen saturation levels are above 92%, above 93%, you can manage the child at home. So what we need to do is just to have an eye that the child is not dehydrated, keep them regular small feeds, keep them hydrated, and if the oxygen saturation is consistently below 90%, only then we need to give oxygen. There's no role, because it's a viral infection, tell the parents there's no role of antibiotics, there's no role of steroids and other therapy. All we need to do is to do a supportive treatment. The next important thing is to tell the red flags. For example, if the child is looking well, and you have diagnosed bronchiolitis, the oxygen saturation is above 92%, child is eating and drinking well, it's only that the wheezes is basically the concerning the parents. So you can safely discharge. You can say that the child can go home and he can be managed at home. So but please tell them the red flags, that if at any point you think that the child's condition is deteriorating, or you can see if there's some bluish discoloration of the skin, the child has, you notice any pauses in breathing, or if the fever goes high, and if you notice that the child is becoming lethargic, irritable, so please bring him back immediately to the emergency. Otherwise, I would like to see you in the outpatient department in 3 to 4 days time. You can just roughly give a time. So you can come and go and see your GP in 3 to 4 days time. Hopefully the child will be better by then. Just keep a check on the child's activity level. They give how is he passing the urine, and is he eating and drinking well, and the skin color. Uh, and the last important thing is give them some reading materials, preferably from the RCH. They've got very good reading materials for the parent information sheet, so you can just give them a copy so that they can go home and have a read at it. So I have tried to cover all the important things in case of a bronchiolitis. So it's a very common case that comes in AMC. If you prepare it this way, it's highly likely that you'll pass this case. It's a very easy scenario, usually comes in, but people, they do confuse it with other common causes of cough. So it's very common. So just practice it this way, and I hope this video will be helpful for you. If you have any queries regarding this or anything apart from this, you can leave a comment and I'll try to respond to you as soon as possible. Thank you. Have a good day.